How does ear fluid cause conductive hearing loss? Imagine trying to listen through a thick curtain. That's similar to what happens when ear fluid builds up in the middle ear. Conductive hearing loss happens when sound waves can't travel properly from the outer ear to the inner ear. One common reason for this is the presence of fluid in the middle ear, which acts like a barrier blocking sound vibrations. The middle ear is an air-filled space just behind the eardrum. It contains 3 tiny bones called ossicles, the malleus, incus, and stapes, that work together to pass vibrations from the eardrum to the inner ear. When sound hits the eardrum, it vibrates, and these vibrations are transferred through the ossicles to the cochlea in the inner ear, where they are turned into signals for the brain. But when fluid accumulates in the middle ear, it changes everything. Because fluid is denser than air, it dampens the movement of the eardrum and ossicles. This means the vibrations don't pass through as effectively. As a result, less sound reaches the inner ear, leading to a reduction in hearing ability. This fluid buildup can happen for different reasons. Sometimes it's serous fluid, which is clear and non-infected, often caused by Eustachian tube dysfunction. This condition is common in children and is sometimes called glue ear. Other times, the fluid is infected, which occurs during an ear infection or otitis media. Infections cause inflammation and more fluid to gather, further impairing hearing. Most of the time, this type of hearing loss is temporary. When the fluid drains or is treated, hearing usually improves. However, if the fluid remains for a long time, especially in children, it can interfere with speech and language development. That's why early treatment is important. Treatment options may include medications like decongestants or antibiotics if an infection is involved. Sometimes, doctors recommend procedures such as inserting small tubes into the eardrum to help drain the fluid. The goal is to restore normal vibration and sound transmission. In summary, ear fluid causes conductive hearing loss by physically blocking the movement of the eardrum and middle ear bones. This reduces the amount of sound energy reaching the inner ear, making sound seem quieter or muffled. If you or your child experience persistent hearing issues, it's best to consult a healthcare professional for proper diagnosis and treatment. Remember, each case is unique, and medical guidance is essential for effective care.